Over 80% of cases, the findings in the abdomen relate to a palpable spleen, liver or kidneys. Bearing this in mind, you should approach the right side of the patient and position him so he is lying supine on one pillow, if comfortable, with the whole abdomen and chest in full view. Ideally, the genitalia should also be exposed, but to avoid embarrassment to patients who are volunteers and whose genitals are usually normal, we suggest you ask the patient to lower his garments and ensure that these are pulled down to a level about halfway between the iliac crest and the symphysis pubis. While these preparations are being made, you should be performing a visual survey of the patient. Amongst the many relevant physical signs that you may observe in these few seconds are pallor, pigmentation, jaundice, spider nevi, exanthelasma, parotid swelling, gynecomastia, scratch marks, tattoos, abdominal distension, distended abdominal veins, and abdominal swelling, herniae, and decreased body hair. If you use the following routines, most of these will also be noted during your subsequent examination. But at this stage, you should particularly note any pigmentation when the patient is being correctly positioned. Quickly examine the hands for deprutations, contracture, clubbing, leukonychia, palmar erythema, a flapping tremor if relevant. After asking you to examine the abdomen, many examiners would like and expect you to concentrate on the abdomen itself without delay, and yet they will not forgive you for missing an abnormal physical sign elsewhere. This emphasizes the importance of a good visual survey. A trained eye will miss nothing important on the face or in the hands while the patient is being properly positioned with the hands by his side. Pull down the lower eyelid to look for anemia. At the same time, check the sclerae for icterus and look for exanthelasma. The guttering between the eyeball and the lower lid is the best place to look for pallor or any discoloration, for example, due to cyanosis or jaundice. Look at the lips for cyanosis, for example, due to cirrhosis of the liver, and shine your pen torch into the mouth looking for swollen lips, which could be due to Crohn's, telangiectasis, which could be due to Osler-Weber-Rendeau, patches of pigmentation, which could be due to Peart's chokers, and mouth ulcers, which could be due to Crohn's again. Palpate the neck and supraclavicular fossae for cervical lymph nodes. If you do find lymph nodes, you should then proceed to examine the axillae and groins for evidence of generalized lymphadenopathy, which may be due to a lymphoma, chronic lymphatic leukemia. As you move from the neck to the chest, check for gynecomastia. Palpate for glandular breast tissue in obese subjects. Spider nevi. These may have been noted already on hands, arms, and face and may also be present on the back. Scratch marks. These may have been noted on the arms and may also be found on the back and elsewhere. Look at the chest in the male and in the axillae for paucity of hair. If diminished, note facial hair in the male. Pubic hair, if not visible, may be noted later. Observe the abdomen in 3 segments: epigastric, umbilical, and suprapubic, for any visible signs such as pulsations, generalized distension, which may be due to ascites, or a swelling in one particular area. Note any scars or fistulae, which may be due to previous surgery or Crohn's. Look for distended abdominal veins. The flow is away from the umbilicus in portal hypertension, but upwards from the groin in inferior vena cava obstruction. With practice, the examination to this point can be completed very rapidly and will provide valuable information which may be overlooked if proceeding carelessly straight to the palpation of the abdomen. If the examiner insists that you start with abdominal palpation, it suggests that there is little to be found elsewhere, but you should nevertheless be prepared to use your wide-angle lenses in order to not miss any of the above features.